Good afternoon, everyone.
Good afternoon. Good afternoon.
How are you today?
Yeah, good evening.
Okay, we'll just wait for the next 3 minutes, 3 minutes, so that people can join, that we can start. How many of us have done something productive with what we learned last week? You have taken some deliberate decisions based on what's your thoughts. How many of us have taken some lifestyle modifiable actions since the last time we met? Please know that the class is not just for us to come sit, listen. We need to take actions, okay?
Yes, sir. Okay.
Elvis Sabiti, what have you done since the last time we met? Great, I can see Machona. Take time to plan some physical activity. So what you can just do, just put on the chat box, what are those, we want to see all of them, what are those things you have done within the last time we met and today? What are those positive lifestyle changing actions you have implemented? If you used to drink, you used to drink. If you used to stay awake till late, do you sleep earlier now? If you used to eat late into the night, do you still do that? What are those actions that have been influenced by the class since the last time that we met? So those actions, you just leave them on the good. I can hear somebody saying that I sleep earlier now, which is very, very good, very healthy. Just leave them in the chat room so that we can have that to look at. So the overall aim is that don't just come and be a part of this class. Let this class make some positive impact in you and be able to influence your life positively. That's what we're looking out for. And those things you have been able to implement, personal actions and goals you have set, just put them in the chat room and let's have it, okay? And those that have tried and they failed, there's no need to feel bad. It happens. Just dust yourself from where you encounter the failure and still pull up from there. Okay, we're already 1 minute behind time now. I can see 9 persons are in the class. Oh, good. Somebody has stopped eating eating heavy meals late at night, and that is very good because you eat earlier so that your digestive system can break down your food or your meals before you go to bed eventually. That's fine. That's fine. So just keep dropping messages on the chat box. Let's see what you're doing differently by the reason of this course that you attended last week, and let's see how that has improved your life. Frederick, what have you done differently, Dr. Frederick? I did see you in the class last week, actually. I just saw you bumped in now. Okay, let's just leave those charts on the chart room. Okay, good. Somebody's now using stairs instead of using elevator. That's very good. Frederick said he has been exercising daily. Very good. So it means there are some productive life-changing behaviors that we've started embarking on, which of course is so good to know and so good to hear. Please, I'll need everyone to mute their mic at this point so that we can start the class. The class is going to last for an hour and a half or thereabout. I want us to be able to have time to talk afterwards and discuss on key issues and what you want to do in going back to your workplace. What are those things you want to implement, okay? I will send you, after this class, I will email you your final assessment It's about 20 questions. So take time to look at all that and answer what you feel is appropriate to all the options that we put before you, and email that back to us at the end of the day. So let me start by sharing my screen now. Can you all see my screen? Okay. Someone using Techno Spark 4. Can you mute your mic, please? Techno Spark 4. Please mute your mic. This phone disturbed us so much last week. Thank you. Okay, others that are not here, they will join us along the line, but we shouldn't waste the time of people who came in much earlier. So let's get the class started now. Okay, let's get the class started now. Our focus for the week, for today, which of course is the final week, we'll be looking at two critical things. We'll be looking at how to personalize your health and wellness at work. We'll also be looking at how leadership involvement in workplace can also help improve workplace health and wellness. We need commitment from leadership, from managers, from supervisors, and this I think is very crucial for us in going forward. Okay. Like we talked about this before, that health is not just the absence of disease, but it's a state of optimal well-being according to WHO. And when we looked at health, looked at well-being the last time we gathered, we're looking at even our emotional health, our social health, intellectual health, spiritual health. So on the long run, it looks at the entirety of our being, of our existence, and being able to be optimally productive while our health is still intact. I want us to keep a very close attention to this slide. The choice we make end up making us who we end up becoming. I say that again. The choice we make end up making up who we end up becoming. You have to learn to be yourself. You be yourself and be the best you can, and don't be a second best. This slide actually is looking at two persons who work in same place and they are friends. Let's take this lady as Majida as a name, pseudonym though. And Majida likes to eat heavily during lunchtime. Okay. Majida has a friend who is called Tutula, and she likes the way Majida eats. Majida likes to eat slowly, decently, and the way she eats makes you feel like eating. I'm sure you have seen people like that sometime in your place of work. So Tutula is even, at the time he started going with Majida to their canteen to have their lunch, Tutula was far slimmer than Majida. But everything Majida orders as her meal, Tutula is forced to order that same meal. That's what you call influence by association. So same portion, same meal. But one thing you should understand is that Majida works as a marketing executive, but Tutula works as a personal assistant to the managing director. What that means is that Majida's job has more of physical activity than the job that Tutula does. They are same people eating same meal. But at the end of the day, this is what Tutula ended up becoming. By eating same meal that Majida was eating, same portion and same time every day. But the truth is, she sees Majida in the place of work, eats those meal. She doesn't know what Majida does to herself after work. And again, understand that the body metabolism also differs. So I shared the story with you last week when I talked about a managing director who likes to eat every of his meal with a bottle of Coke. And one of his staff was wondering and was concerned until she got to know that at 4:30 p.m. when the MD leaves the office, she goes to lawn tennis court and play tennis for an average of 2 hours every day. What I miss is that whatsoever beverage drink he takes in, the physical exercise is involved in the evening, he has the chance to burn out everything. So Majida doesn't stay in the office. Once she finishes her lunch or whatever, she hits the street, she looks for her account. So she's physically active and on the road at all times. But Tutula sits comfortably. You can see how same meals they were eating, but different exposure to physical activity make all the difference. Majida remains her real shape that she has always maintained, her real size she's always maintained, but over a period of time, this is how Tutula ended up. Remember I said that Tutula was much slimmer than Majida before you started eating with Majida and having those kind of meals. So what we're saying, you just have to be yourself because you don't know who you imitate, what happened behind closed doors. Difference in body metabolism and different physical activity exposure based on the different kind of jobs that we do. Then I put this here. Now, same people go out, want to have same meal, and you are attracted because somebody is eating this meal. You may not be hungry. Like we defined appetite last week, and we defined hunger, and we defined satiety. But you see somebody eating food out of appetite, and you request for the food also. Don't imitate people to eat because you see them eating. Eat because you are hungry. Like last week, we discussed hunger as the body's psychological need for food, and learn to know when you had enough, and learn to know when to say no. We use the rat experiment. You remember last week. Now you're seeing these people eating, and you are forced to eat. This is even late into the night, maybe at a pub or wherever. You are forced to eat what they eat because you saw them eating all the greasy food with a bottle of beverage drink by the side, or have a cup full of popcorn with a bottle of red wine by the side. You will eat this, but after eating this, what happens? You can either go back home and sit down, have another cup of beverage drink while you sit on your sofa to watch television into late night. All you do is come in, sit down, have your remote. What you do with this, you come back home to fuel a new session of sedentary behavior. You sit all through on your sofa, watch televisions into late night. Please mute your mic. Watch television into late night. But the person you saw that was eating that meal did not take to this kind of behavior. You don't know what she does or what he does after that meal. But the good news is, when the person that you saw taking those meals, when he gets back home, he hits the gym. Please mute your mic. The person hits the gym and start working out. She takes to the street and start burning down those calories she took in. She's pumping out those calories. But you who took the same calories, you go home, you sit. Can somebody mute that mic for me, please? You go back home, you sit on the sofa, and you end up accumulating those fats in your system, and which of course is inimical to your overall health and well-being. So you see, different food we eat, different behavior, and different things we do when we get home. So one is fueled by sedentary, one eats when she gets home, she burns them out before she goes to bed. So understand the fact that you have to be yourself, you have to live your life. You do not have to imitate or mimic someone because you love the person's eating habit, because you love what the person eats. Know what is good for you. Know what you are comfortable with. Eat as much as you can. Learn to know when to say, I've had enough. That food is available everywhere doesn't mean you should eat beyond what you know your body can cope with. I don't know if this happens in your country, but I live in Lagos, Nigeria. I get really embarrassed when we go to functions when we have to see, when we are all exposed to buffet. And I see the way some people treat buffet as if without this food, I will not be alive. They treat buffet, they take what they can eat, what they cannot eat, and most time, bulk of the food is left away. That food is available everywhere does not mean you should eat more than you know your body requires. We talked about eating disorder last week and disordered eating, and we talked about people that is a psychiatric, that is even known as psychiatric disorder. People, they see food, they eat and eat until they get back home, they start putting their hands in their throat and start vomiting that food. They just have a way of not able to maintain self-discipline when they have food around them. Understand that nobody is saying you shouldn't eat. We mentioned it last week that if you can take it in, be sure that you are able to burn it out. That was where we talked about energy intake over energy expenditure. So you have to balance the two out. Energy balance concept talks about energy intake over energy expenditure. You have to create personal motivation. What motivates you? We talked about it last week. Said, do you have parents or siblings who are unhealthy, obese, or have diabetes? This should be a self-motivating factor. You don't want to end up like your parents, your siblings who are diabetic, who are hypertensive. If you have any of that within your family, you must take personal action. Let that be your motivation and part of life. Please, Ugochi, mute your mic. What are your concerns? Is this motivated to change your lifestyle or your behavior, knowing that you have siblings that are diabetic, you have either parents or both parents that are diabetic? These should be things that should motivate you. Create your personal motivation. Do something about it. Ask yourself some questions. If I do not create motivation to work contrary to this thing and create a healthy lifestyle for myself, the outcome that will come with it, is it what I desire? Am I able to? At the end of the day, you must ask yourself this question. Beria, please mute your mic. Enas, please mute your mic. Make an action plan. Commit to change. You will make healthy choices when you are ready to commit to changes. Changes are very important, because most times the only way to break bad habits is to replace them with good ones. What are those bad habits you already know you are exposed to? What are those habits? Think them through. If possible, journal it, write them down, because most times, just take a book, have a two parts of it, have a table. One is a good habit you're already maintaining. One is the bad habit. Be honest to yourself. Write down those bad habits, journal them down, because until you can write them down, you cannot work on them and start working on those bad habits. Set your wellness goals and make it very high. Set a goal for yourself, what you want to achieve. I want to maintain a healthy lifestyle. I want to cut down on my weight. I want to stop alcohol intake, or I want to reduce it. I want to stop tobacco use. Decide what you want to do. Make a plan, have a goal, because if you don't have anything you are shooting at, you will shoot at it. Have a goal, have what you are shooting at, set it. And once you set those goals, where do you start? Start now. Start by setting a date to start the goal. What date do I want to start this goal? Set a plan of action. What are those actions I want to achieve, I want to put in place? Track your progress and evaluate and reevaluate where you are in the progress. There are room for sleeps that you said, I won't eat so late anymore. And you come back, this day you came back from work so late, and you find yourself you're so hungry, you ate at about 8:30. Don't blame yourself. Don't be too hard on yourself. There are room for sleeps, but make up for those sleeps the next day. But let it not be too frequent, okay? Be true to yourself. And when you make those SMART goals, make them specific, make them measurable, make them attainable, make them realistic, and have a time bound. Let it be time bound. Have a time allotted. I want to drop my weight by 4 kg. When do I want to achieve that 4 kg? Let's assume maybe by March 30th. I want 4 kg out of my weight. That's what you want. That dress I used to wear, I can't wear it anymore because my waist circumference has grossly increased. I need to cut down on those parts of my body so that I can wear that dress again. Most of us, we have a lot of dresses in our wardrobe that we cannot wear today because our weight has grossly increased, yet every time we keep changing our wardrobe, okay? Then get going at this plan you have set. Then outdo yourself. Learn to set competition for yourself and learn to outdo yourself. Allow mistakes to happen. Like I said earlier on, don't be too hard on yourself. Allow mistakes to happen. Then shoot on those lifestyle changes. And one thing you must ensure is that these plans you have made, you will succeed in it. So learn to shoot on those goals, those plans you have documented, those things you've done, and shoot at them. At the end of the day, ensure that you succeed on these goals. Healthy choices and healthy changes. Elvis, please mute your mic. Let's learn to eat healthy food. Eliminate food that are processed. Highly processed food are not good for you. Eliminate processed food and learn to replace them with food that are healthy, okay? Cut low on your sugar intake, okay? Choose balanced diet, food that have both micro and macronutrients. Choose balanced diet. Fill up your system with fiber. Fiber is easier to break down. At DBC, please mute your mic. Fibers are easy to break down, okay? Fiber are easy to break down. Do not skip breakfast. Breakfast is the most important meal for you in every day you come into. At DBC, beyond that, mute your mic.
It's not me. I'm not sure I'm the one. I'm not the one.
Your mic is not muted.
The population is in their hands. Serious stuff. I mean, you think you'd be able to put aside your petty rival to the world? No fucking way. I'm not working on this guy. As the minute you kiss your phone, you kiss goodbye like that. She fucking. Yeah, Mr. Harson here only knows how to blow shit up. And the fact is, no offense. Oh, no offense. That's tough. Some bitch. That'd be wank.
Elvis, can you help us mute your mic, please, Elvis? Please, this is not fair. This is not. We are all adults here. I think we should know what's the right thing to do. Okay. Please, let's eat food that we know are low in sugar, and let's choose food that are balanced in diet. Most time we tend to skip our breakfast, but breakfast seems to be the best meal we need for the day. Eat when you are hungry and be mindful of what you eat. Okay? Don't just eat because there's food around. Eat because you are hungry. Like we defined hunger last time, is the psychological and biological call for food when the body needs it. Be dedicated, determined, and be disciplined, and allow mistake. We talked about that earlier on, okay? Please, I want to discuss this pedometer issue. Please, if you have no pedometer, learn to have a pedometer and use it. If you don't have a pedometer, download it on your app store. And something very, an eye-opening experience I had for the past 2 days. I have been seated fully working on many slides I have to work on because of the programs I had. But I realized in each day, the time I spend in my workplace, I do not make up to 700 or even 800 steps a day. It happened the first day, second day, and I realized that's applicable to most of us. When you sit in the office for the number of hours you have to stay for, you find out that you do not make 5 minutes of work time for that number of 8 hours to sit in the office. So what I do right now, when I have most administrative work to do, when I get home, I have to work at least 1 hour to make up for the time. So learn to monitor yourself, download pedometer on your phone, look at what happens to you. At the end of the day's work, check how many steps you have made. It will baffle you how many steps you have made, and it's just insignificant. So when you get back home, please create time. Get off your work clothes, put on your sports clothes, hit the street. It is very good, and it's for your own overall objective. The food that we eat these days, let's learn to minimize it, cut down on the kind of food. Let's make our plates colorful, okay? And eat them in the right proportion. Most times we see food, we feed the plate with so much more than what we can even eat. Like we said last week, any food that is bigger than your fist size is an overdose. Food has to be apportioned properly. Look at your fist size. Any food that you eat that is bigger than your fist size should be considered an overdose. Please keep that in mind. I need to share Barbara's story. Barbara used to be very large, has a lot of weight, but the truth is, when you talk about weight borne, you have to come to a place of personal conviction, and that's what we're talking about here. When you come to a place of personal conviction, where you said, I think my weight, I don't just like it. Weight is not doing me any good, does not add any value to me. I need to do something deliberate. So what Barbara did was to see how she can she realized that 80% of how she can burn out her weight has to come from the meal she takes in, and only 20% comes from exercise. What she had to do was to modify what she eats, how she eats it, at what size, and when she eats it. But at the end of the day, this is what she got. So understand the fact that we can all do this. Decide, I don't like my body, I don't like the weight I carry. I need to burn it out. Set a program, set a goal, be disciplined about it, and over time, I bet you will achieve it. When you achieve that result, there's a kind of fulfillment that comes with it. It makes you happy. There's a release of some hormones in your body that it just makes you happy because you have achieved something. You need to have a support system or partner to be able to make this work. And this is very helpful in pulling you through. It could be a friend, it could be somebody you trust, it could be a neighbor, it could be your spouse, anybody at all that can walk through this road with you. Have a partner that you can go on this journey with that will encourage you to be able to do all this. It's very important, okay? Get rid of all triggers, all undesired behavior. If there are places you go to, you find out that when I go to this place, I'm forced to eat. There are friends you meet up with. When I meet up with these friends, I'm forced to eat, I'm forced to drink, I'm forced to smoke, I'm forced to engage in behavior that I want to drop. One thing you must do is to foresee how you can limit the proximity between you and that your friend is very important, okay? All those triggers, Candy. I have a friend, a doctor in Nigeria. I mean, she told me her story. He said she was so addicted to chocolate that when she wakes up in the morning, she sees, after seeing her patients, she goes into the mall to go and buy chocolate. She was doing it on a daily and consistent basis. She told me one day she was driving to the shop. She asked herself, what is this between me and chocolate? Look at my size. Look at how fat I am. Look at my age. She said she told herself, I will not buy this chocolate. She went to the shop. She couldn't come for it. I said, no, I won't buy. She drove out. And she was driving back to her office. She said, I need this chocolate. She said she did that round about 4 consecutive times. She stopped in her car and broke down and started crying and told herself, this has gone beyond just buying chocolate. This has become a high level of addiction. She said, realizing that on that day was what delivered her from chocolate. She drove off, she never came back. And that was the last time she took chocolate. So understand those triggers, candies, those things that serve as addictions, those habits. You need to break them so that you can achieve those goals you have set for yourself. You must take it personal, write them down. Like I always say, what is not written down does not exist. Okay? Write down benefits you have received from that goal. Those goals you set, write them down, the benefits, keep tracking them, continue to avoid the triggers and the habits, and understand your social behaviors. Those places you go to that are not good for you. Begin to avoid those places. No matter how small the success you record, please celebrate yourself. Okay? No matter how little the success, if you drop even 1 kg, it's good enough. Please celebrate yourself. Okay? It's very important. Make personal health choices. Some of those things is to seek, look at those things that are not beneficial to you. Things like abstaining from tobacco use, abstaining from risky sex or having multiple sex partners. Release yourself from those things that you know are not healthy for you. Please stay from those things. Alcohol use, drug use, even if you prescribe drug, please use them reasonably. But I know there are some people that have underlying health conditions. You're already on some medications. I'm not speaking to you here. If you are on a medication, please follow up on your medication. But for those of us who just want to abuse drugs, it's part of it, okay? Plan your health assessment. There are many of us who have not done health assessment for the past 4 years. It's not healthy for you. Those who think they have no time for fitness, sooner or later, we have to find time for illness. You cannot stay fit. The next thing you will do is that you will find time to visit the doctor when illness comes knocking on the door. You must do a scheduled annual health assessment. Fix a time in the year that you feel, okay, in the month of March, I have said that in second week of March, I've set that week as my annual health assessment program for the year. But the truth is that most of us have vehicles, and our vehicles time sheet for servicing, we have them at our fingertip. And when that time sheet for maintenance comes for servicing, we don't miss a day. We run to the garage and they service our cars for us. You need to draw such a sheet for yourself. Have a plan when I want to do my annual health assessment every year. Once you have done it and your result is out, please act on the report. It's very important. Why do you do your annual health assessment? It's better because those early indicators, once you're able to track them, you are able to manage them and survive them than when they go out of control. For ladies, I mean, go cancer screening, do it every year or every other year, because research says that early detection is your strongest survival tool for cancer. So it's very important. Then return for reassessment, haven't done all that you have to do, and to be reassessed to ensure that all those things that were found, you have dealt with them diligently. Then create time for more exercise. Like we said the last time that exercise is medicine, and we said doctors should prescribe it. Then let's look at the place of leadership. How does leadership really come in? We must learn to understand that health and well-being issues must start from the boardroom to the gatehouse. It's not a matter of what is sacred. We make it only available for only the top management staff, only the board of directors. No. The truth is, one of the things we do in Nigeria right now from our company is that every company we consult for, we have done a study over time. We realize that even the health cover from the health insurance plan, they are never extended to some casual staff, or even the drivers. The one we did recently, we found out that the drivers were isolated or excluded from the overall health assessment for the why? Because they were outsourced. And then we asked the question, yes, these drivers were outsourced, but have you spoken have you made it a requirement for the outsourcing company to do medicals for their drivers? They said no. But I said, and you allow these drivers to drive your most valued person in this company, and even the least person, as the case may have it. Some of the drivers, they drive your MD, they drive the directors, the same drivers. They say yes. I said, it doesn't make any sense having the MD go through annual health assessment every year, or he sits and be chauffeured by a driver who never went through annual health assessment. What if that driver had underlying medical health issues and a crash happens? Will the MD survive? They said no. Will the car be wrecked? They said yes. Will the driver be injured or die? They said yes. I said, the truth is that it's what you call it's not a wise decision, because you have your valued employees be driven by outsourced drivers who have not been open to annual medical assessment. Take, for instance, you have a driver who have underlying seizure issue. There are neurological defect or disorder in the guy's system that are not manifesting yet, and he carries your MD and crashes. Your MD dies. So what have you gained? So even if the drivers are not your direct employees, they are outsourced drivers, you make it a prerequisite for that outsourcing company that at S&S time every year, I want to see the annual health assessment that have been done for all the drivers. And you have made it a part of your plan, of your policy, and they have to abide by it. One of my colleagues here told me some time ago, he was on the bike, somebody put him on the bike, and right at the middle of the journey, the bike driver had seizure. And then we have such people who also drive. They don't even know that they have underlying neurological defects, and those seizures could happen while they're in the middle of the journey. I used to manage hospitals in the early days of my career, and I remember a very clear case where I was living in Port Harcourt of one man that was driving, and he's in between the tree, his one of his legs lost every muscle traction. He had stroke. What saved him was that there was a stationary sand that he ran the car into, and people ran to rescue him. But we that are seated here listening to this teaching today, when last did you do your annual health assessment? You drive yourself perhaps every day. Remember, you are no worse from the driver who is assured an annual health assessment is never done for him. After this class, please call your insurer, call your your service provider, book a date so that you can check what is really your health status. It's very important, okay? Workplace health and safety should be documented as part of our policy and must be seen as an integral part of our policy. And we must be appraised every time where we are in this workplace health and wellness policy. We have to let employees know what is in for them. When employee does not know what is in for him, he doesn't get committed to it. So we must educate employees to know what is in for them. Why do you need to do your health assessment? Because you want to know your health status so that if there are issues that were flagged, they can be controlled early enough. And this must be well communicated to everyone. And this must also be made compulsory in our workplaces and ensure that we follow up all that we have decided to do. We need leadership to walk their talk, to act as mode. That's Mark Zuckerberg. You all know him for his continuous jogging. We have to learn to allow employees to take the lead. If you support this initiative, then you take the lead. I mentioned to you last time that we met, I saw a certain company in Nigeria. I saw on Friday the MDs and the staff, they were jogging at about 4 o'clock with their sports clothes. I mean, that's very impressive. So such smart initiatives can be initiated in your office, and know when it could be once a month, it could be once in the quarter. Do something, but let's ensure that there's a program that we run. This is Richard Branson. We all know him for his fitness behavior. If it is tennis, play it. Some organizations have gyms of their own, not outsourced. They have it situated somewhere. So every staff is free to go to those gyms, use them for their own personal health and well-being. And the MDs are seen also using those gyms, not that we design it for workers. So we must, in leadership, in health and wellness, employees must walk their talk. Don't just talk and look the other direction. Whatsoever you say we should do, take the lead. We need to see what you call leadership by example, driving health and wellness within the workplace. Then we have the traditional workplace leadership, where we have, and this I think mostly in workplace in Africa, we have to see how we can fade this leadership system out, where we have bosses and not leaders. This is totally inimical to the growth of health and wellness within the workplace. And such bosses, what they do, they focus on profits, and that's what drives all the ideas they have. When profits stand alone and does not stand in tandem with safety and well-being of the employees, it's not balanced. When you have leaders that drive profits, we don't need them in this age and time that we are in. We need leaders who know how to drive the health and well-being of employees and productivity, standing together as partnership. Okay? Employees, in this kind of leadership, employees are not seen as an indispensable part of overall success. So they believe, oh, let's just make the profit. But you need employees, healthy employees, to be profitable. So this kind of leadership is drunk with power, and all they know to do is fire and hire. And we have this kind of system that run in the place. It creates tension. We may not talk about it. Everybody's mutually mute, but people talk when they have to meet. But that does not stop the fact that this disturbs us mentally and does not improve the health and well-being. See, the truth is, you don't need to have workers that work under fear. You need to have workers that will do the right thing, whether the leadership is around or not. The right thing must be done. And this kind of leadership also maintains one way. They are it's so dictatorial. They talk to you and they don't listen to you. We don't need this kind of leadership. We need leadership that can look at the well-being of employees, where communication system, where information comes from up down and goes back from down to up. We need a two-way communication. Okay. The concept of health and wellness program will be pioneered, by the leaders, And we talked about, we define what wellness means the last time. But one thing I want to put up here, I want to take it as according to Larry Chapman. He said the purpose of worksite wellness program is to improve the health and productivity of staff and to reduce health-related costs by helping to change towards a healthy lifestyle. Most times, because we are not concerned, we don't know how much we lose, how much the bottom line cost is of employees' health to the company when employees are not well. We are not able to look at how many employees went to hospitals within the year. How many people were admitted? What is the direct cost of health to us? How many people were admitted? For what reason? We need to start looking at this data to use to drive the health and well-being program within the workplace. Then what's the ILO position? I mean, we talked about this last week, but most profound here is that potential solutions such as leadership, communication, and a focus on learning and development are essential for anyone committed to making workplace a more decent, satisfying place. We said the last time that we spend more time in our workplaces. If this being true, it means our workplaces should be healthy and should not be treacherous to workers, so that we can feel comfortable and not be unduly mentally burdened while we spend those 8 hours in the workplace. We can never lose by promoting workplace health and wellness program. It should be an integral part of our management blueprint. I mean, there's nothing, head or tail, we win. So it's important that this is instituted in our workplaces and ensure that every employee benefit from it. Because at the end of the day, like I said the last time, how will employees see you that you supervise, that you manage while you were working, and now at retirement you see yourself maybe in the local community shop or in the mall, and you look at that worker and you know you were that worker's manager. The worker looks a caricature of who he or she used to be, looking unkempt and worn out, and looking illness ridden. But you knew that you could have done better if this employee's lifestyle could have been better if you have managed him properly. So these are the things we owe to our own conscience, and we decide what we want to do. Is very important. What are some studies saying? According to a recent NASA study, it found out that people who exercise have twice the stamina and productivity in the last 2 hours of the day than their sedentary counterparts. What that means is that there's resilience. The endurance is more. They're able to stay. They have more energy. I mean, during the last 2 hours, the most stamina during the last 2 hours of the day than those who don't even get involved in exercise. Okay. Data from one carrier show that members engaged in its wellness program experienced 15% drop in claims over 3 years period, and that by year 3, companies with 5,000 employees or more record direct medical savings averaging $2.5 million. So you look at it that whichever way, we save a lot of cost, bottom line, for the organization. So when you look at it, improving the health and wellness program in our workplaces, it's not expensive. It helps us to save money, keep workers alive. At the end of the day, it reflects on our bottom line. It's very important. Top executives are either not aware of the statistics, which I talked about before, because if we take the statistics and put them together, we'll realize how much we are saving by improving the health and well-being of the employees. Because at the end of the day, our employees are not optimally productive because of the exposure they have in their workplace to things that may affect their health and their overall well-being. Increasingly, the issue is being successfully addressed by wise executives who recognize that employees are most definitely human beings. They also are machines of production that require maintenance. I said earlier on, we have timeline that we set to maintain and to service our equipment. What timeline have we set for the annual medical assessment, annual medical review of our employees? That's one question we should go back and ask our employers, or one thing we should go back and start instituting within our workplace. when you look at what the Global Wellness Institute says, it talks about wellness at work. If you look at this vicious circle, I mean, where every employee looks so unwell, they are unmotivated, they are unwell, they are disengaged. I mean, I don't know if you heard the concept of what you call moral disengagement. They don't care what happens anymore. Anything that want to happen, let them have, but they know because you have not taken care of them. You haven't. Okay, it brings to a business where everybody feels unsafe, feel unhealthy, they become hostile and stressful, and there's high level of mental health condition within such a workplace. Then, but I think when you juxtapose that with the virtuous circle that actually looks after the health and well-being of employees, you have what you call healthy employees. The energy is boosted, there's high motivation. That means people feel fulfilled, they are joyful, and healthy habits are being promoted. So when you look at it, you decide what you want. Do you want to have employees whose shoulders are down, demotivated, stressed? They look like heaven and earth has passed away. They come to work because they have to write their name on just the sheet so they can get a salary anymore at the end of the month. Have you looked at, are they happy working with me? Have you assessed yourself as a leader? What kind of a leader am I? Have you gotten an auditor? Audit my workers on my level of leadership. Because if you are not a good leader, you will raise a system where people fall into what you call the vicious circle. Ask yourself, what do they feel about me? Am I only concerned about profit? I'm also concerned about the health and well-being of our employees. In this place where I work, I don't call it a workplace. It's like a family. I don't have so much. We don't have so much staff here, but everyone in this place, if this office, the management system, has not influenced you positively, you don't need to remain here, because we want everybody's success story to have a place where this company is mentioned, because that is what we call the right kind of leadership. So we need that to happen in our workplaces. What is some smart leadership wellness initiative that could be set up? For breakfast meetings, replace those donuts and snacks with fibers and fresh foods. Most of us, some of us, in my early days in my career, we used to enjoy the donuts. We look forward to see the donuts and those meat pies in our Monday meetings. No, take those things off. Replace them with fruits and with food that have high level of fiber. Review your cafeteria menu state. Arrange for food, get your food vendor. If they are your vendors, you can talk to them. Replace those high calorie food that create laziness and excess fat in your employees. Replace them with healthy choices. I mentioned last week, I don't know if I mentioned last week, that the bigger your waist circumference, the more susceptible you are to illnesses. So when you get home, take your tape, measure your waist circumference. We did the waist to hip circumference measurement formula the last week. Measure your waist circumference. If your waist, if where you put your belt last year and this year you find out that you are drilling a new hole in your belt to have a new hole to expand so the belt can be big enough for you to put a new hole and it can go around your waist, know that you are not doing well at all. Okay, look at what were you weighing 2 years ago? What's your body weight as of today? Please, you need to have this at your fingertips to know how you're doing. People like convenience. Even if we have a place vending machine in our offices, learn to have those vending machines filled with food that are healthy. Have fruit bars, have food pack or bottle of water in those vending machines. When people come, they want to use the vending machines, and all they have is a fruit pack and fruit bars and water. They will have no choice but to take it. Why? Because people like convenience. So when they think of the time that are going to walk across the road to go and get a bottle of Coke or beverage drink or get those snacks and sneakers, they will choose to make do what's available. So that's what you call the psychology of convenience. So you also create better options for them that they can have within the workplace. Plant events, group activities that encourage employees to become active. Like we talked about last week, we mentioned the no elevator day program. We talk about the stand-up meetings, isn't it? So let's create events. You can say, I want my workers and I want to have a road walk one Saturday of the month. It could be anything. want to jog maybe for 4 to 5 p.m. at last Friday of the month. Decide what you want to do. Have some very meaningful but very cost-effective project. Like I said last time, that my waste bin is not by my side. My waste bin is outside my office door. Why have I done that? When I have to discard any waste, it means I must get up from my seat, walk to that waste bin and discard it, so that it gives me a new level to assess physical activity. Have your printers. Your printers can be anywhere in the office. So when you send document for printing, you are able to go out to go and take that document as it's printed. What this does for you is that it helps you to assess some levels of physical activity instead of maintaining sedentary behavior. Provide a supportive environment that makes health choices easy. Example, let people have a self blood check machine in your office. Do it yourself. There's one we set up for one of our clients. You just stand there, you put your arm on it, and once it gets to this place, it grips you on its own and it gives you your reading. So you need to know your numbers. Have those kind of smart moves. You need them. Put scales. Let there be weighing scales everywhere in your office. Okay, it's very important so that when people see it, they can use it at any point in time. So we find out that somebody is eating over the weekend, say, oh, I don't know what my weight will be when I get to the office on Monday. So there's already a consciousness. I have to stop before I build up weight. I build up a new weight when I get to the office on Monday. So these are some of the smart issues we can have. I mentioned pedometer earlier on, but according to the report by Andrew Sykes, he said Americans on average walk only 5,000 steps per day. Our data show that wearing pedometer encourages people to increase that activity by an average of 3,000 steps. That's very correct, because it happened to me. I was able to see from my pedometer that I have only clocked 750 steps for a whole day. And where the average thing I should be clocking is between 5,000 to 10,000 steps. So when I got home, I needed not to be told. I needed no one to cajole me. I just put my work clothes, go to my sports clothes, and did a 1 hour walk, and I was able to exceed 5,000 steps. So it's very important. Have that to guide you. Have a pedometer so that it tells you how many steps you have done in each day. When I saw this report, I was marveled. It came from Global Wellness Institute. It was looking at percentage of employed workers who have access to workplace wellness programs and services. And you look at it, and most of us here all are from Africa. You look at Africa, it's only 1%, and this is so shameful. This report, I've taken it right now, and I'm going to start talking to our colleagues about it so that we can improve on it. Look at even the data globally, it's 9% globally. But when you look at that, look at North America, they're doing what, 52%. Look at Europe, 23%. When you look at Middle East, of course, they're closer to us, 7%. So we need to see how we can change the narrative by these things we're learning right now, so that we can learn how to improve our access to health and wellness programs. And most times what we have, I can't blame most people, because what we have across our policies is, we have access to hospitals. Access to hospital does not mean you have access to health and wellness programs. So when you talk about health and wellness program, it's focusing more on prevention pattern. When you talk about lifestyle modification, when you talk about going to hospital, it's talking about curative pattern. When people fall ill, they need to assess treatment. Okay? So there are two different things entirely. There's some disturbing global statistics says the world's 3.2 billion workers out of a global population of 7.3 billion are increasingly unwell and growing old. Increase in chronic disease trend has set in. For the past 4-5 years now, Europe have been talking about aged workforce. We don't have that in Africa good enough, but the people we have in Africa that are in the workplace, how much access are they have to health and wellness services? That's the question we must ask ourselves. According to Jessica Price Jones, in her new book called The Happiness at Work, it says she calculates that workers will spend an average of 90,000 hours at work in their lifetimes. But the question I want to ask, these 90,000 hours you may spend at work, according to her report, how much of these hours do you spend assessing physical activities? That's the question we must ask ourselves. Now, some of that study said that 38% of employees suffer excessive pressure because technology that we have today, it brings in new pressure to the workplace and work demand from our supervisors and our bosses. So they suffer excessive pressure. 24% are actively disengaged at work. I mean, you don't connect with the work policy. You don't connect what happened at work. You are just there. That's what we talk when we talk about presenteeism. You are just there, but you are not optimally productive. There's high level of disengagement. 2.3 million annual work. We have 2.3 million annual work-related deaths, and by accidents or by illnesses. 313 million annual work-related accidents happen in the workplace. Workers' unwellness could be costing global economy 10 to 50% annual economic output. So, like I said before, whichever way you look at it, head or tail, you don't lose anything. When you embrace health and wellness concept, programs, initiatives for your employees, you gain at any balances you put them in. Some of the things we expect leaders to do is to look at what you got. How many of us have heard about sick building syndrome? Sick building syndrome happens when you have people walk into an office and that office make them sick. Or you walk into a building, that building make you sick. I mean, when I used to work in a company some time ago, we had a youth couple who came to serve with us for 1 year. And each time he comes to work, he falls sick. He has running nose and he has nausea feeling and has kind of lethargic feeling. So, and I kept reviewing. He said when he goes back home, he doesn't fall sick. So obviously, I knew that there was something wrong in the building that he was reacting to. So I was looking at, there was no rug, the windows blinds were tidy, but I eventually realized that we have some level of harsh air fresheners that were positioned in different places in the office. What I did was to remove all the air fresheners and open the window to air the office over the weekend. And he came back to work the next morning on Monday. I realized this guy wasn't sick anymore. So most times, what makes us sick are the things that are present in the office. Now we are talking about nanochemicals. Most of the building materials that we have today, they are made of nanochemicals. We're having technology improvement, and most of the things that we have in our offices also have a high level of making us sick. You have office that is closely linked to a place that is very cold, and you have mold of cold. I mean, you have wetness of your walls, and you are seeing those things. Those things could cause a high level of sick building syndrome. So you have to identify them and take them out. And what are some of the symptoms? You have headaches, you have eye irritation, you have fatigue, you have respiratory issue, chest pain, cough, and all have you. And these are all related to what you have that are available in the office. But the truth is, when you take those things out of the office, those symptoms will disappear. When that person leaves the office and goes to a new building, those symptoms will disappear. So you find out that these are things that are prominent within your building. A study in the UK has it that high performance office building can improve productivity by 12.5%, while worse building reduce productivity by 17.5%. So you see, when you look at it, whichever way, you all stand to win. So when you look at your office, do a survey, walk around inspection, find out what are those things that are in my office. And when you see a worker that is falling ill, regularly, do a surveillance, find out what are those things that are in the office, in your office that is aggravating or that are not aligning to the person's underlying health conditions. And when you see them, once you take them out, that worker just gets better. Some of the things leadership must recognize workplace stress as a top wellness deterrent. Let's calm down the stress. Let's distill them, okay, so that people can feel comfortable. The workload, can we take them out right now? Even in the time that we are in, when we have COVID-19, let's ensure that we are able to guide the employees to a place of wellness and stability till we get out of this phase that we are in. When this phase is out, we can start thinking about profit. What we should focus on right now is to guide employees, ensure they are well in the workplace. Let's build social community strategy, interaction, put things up, games. And again, let's have humanity. Let's bring humanity back to the workplace. Show empathy. How would you want to be treated if you were in this worker's shoes? The pressure you're putting that worker, if you were putting that pressure when you were at his or her level, would you like it? If this was your son or your daughter, would you like him or her being treated this way? Let's be fair to all men. And at the end of the day, as leaders in organizations or workers in organizations, let all of us go back home and do a self-audit at the end of every day's work. What was that audit? Did I do as much as I ought to have done in workplace today? How many people was I able to help? Who is that person that I knew I was not fair to? You see, when you do this thing, you have satisfaction. You're able to find out, yes, I didn't handle this issue very well. The truth is that you have to be honest to yourself. Issue you didn't handle very well, tomorrow is a next day. You have an opportunity to address those issues. Don't be too egocentric to say you are sorry. Create a day of gratitude. What you have achieved. Be grateful for every little thing that you are able to achieve within the day. So these are the ways we can walk around this. I'll pass through this. And let's rehumanize the workplace, and let's be leaders that people can be endeared to. Okay, if people gave you their back to climb on when you were climbing, now you have gotten to the peak of your career, you threw away the ladder. People need you to climb to where you are. Remember, when you were climbing, there were people that supported you. Don't forget that. So those that are climbing, you need to be available to support them. Report have it that General Electric, Grant Thornton, Netflix, and Virgin Group provide unlimited vacation days to their salaried staff. So how many days you want to take? But I said, I don't know if I mentioned that the last time, when you have, in the mental health class, when you have workers that feel they want to take extra time for their break, let's have what we call systems flexibility. Systems flexibility. The truth is, we are not productive because we spend 8 hours in the office. As a matter of fact, if you follow what happened in France recently, where there was a new law that says that no employee is under any obligation to respond to an email that is sent to his mailbox, official mailbox by his boss. You don't have any moral responsibility, because after work hour, any email that is sent to you, you can decide not to respond to it, and nobody will hold you accountable. Even Sweden or Finland are doing a test case right now. What they're looking at, do we really need to stay in the workplace for 8 hours? But one of the things that have come out of that study right now is that they found out that the later hours of the days that we spend in the workplace, people use to look at social media. So understand what works for you. That I put a peak in the morning, that I put a peak during the afternoon, that I put a peak during the evening. Understand what your peak time is and utilize it appropriately. This is a guy I need to look at. Is the MD CEO of Steel House. I need to follow the next few slides very, very deliberately. His name is called Mark Douglas. And report has it that Mark Douglas, he runs a company called the Steel House, a marketing and advertising company. But this is one employer that the whole world is studying right now. What has he done? He gives employees $2,000 to go on vacation every productive year. And these have made his workers to be more productive. I was teaching a certain corporation. I was mentioning when I used this slide some time ago. And after the session, some guy raised up his hand. I thought he was going to ask a question. He asked me, do they have vacancy in that company still? I said, I don't know. Google that. If they have, well, you want to apply. But I had to see you. You want to lose this tab? He said, not at all. See me in my office. So the truth is, people go to a place where they are appreciated. They grow, they flourish in some places. And what studies have said that if you work for Steel House, the company will pay you $2,000 a year to go anywhere in the world and do anything you want, provided it's not illegal. You can spread it out across multiple trips or blow it all at once. Douglas leaves it all to the team member. What that means is that so long as you work for the company owes you $2,000 every year to go on vacation. And here you see how some people, they are flagging the new term called workation, where you have to, yes, we allow you to travel, but take a part of your work, allow us to know that you are still available to respond to email. No. If you're on vacation, shut down. Let's go back and refresh, recharge, come back to the office with a better productive mind. So he's fueling it. Whether you want to go at once, it's your choice. Do you want to use money to do one trip? It's your choice. Do you want to spread it across several trips? It's your choice. These are some of the things we start thinking about in our offices. Those of us that have what you call workers cooperative. These are some things you start thinking about. Workers cooperative is not just meant for you to take, go and buy new clothes, go and buy new electronics. Create time for vacation. Create time to unwind, okay? He said, our culture is really simple, he said. It is based on trust and ambition. I trust of leadership, and we promote the ambition of, we fuel the ambition of workers. It's very important. And what he says that the trust goes both ways, he added. Employees who buy their plane tickets on a Monday will be reimbursed by Tuesday. So nobody's telling you, okay, go and sign this paper, go and fill this in. Once you have shown that you have bought your ticket, you show to the accountant, the next day you have reimbursement. But most times it's not when we say, oh, you are bought, okay, wait, let's see you approve it. No, you are reimbursed the next day. It's like if the employees can't front the cash, if you have not enough cash to buy the ticket, you are giving the company's credit card to book your flight. And these are some of the things we should look at. And once you go on this vacation, all your expenses you made, you bring them back to the company, you are reimbursed your hotel accommodation, sightseeing you went to do, your meals while you are on vacation, so long it doesn't exceed the $2,000 cap. These are some kind of motivation. Tell me, my dear colleagues and friends, why won't people that work in this place commit themselves to this organization? Why won't they stay healthy? Why won't they be productive and think for the organization at all times? So understand that every little initiative that we bring up has a whole lot of way that it grows our organization. The results have spoken for themselves. Definitely, Douglas says. He said, in the last 3 years, only 5 employees out of 250 have left our company. 3 of whom left for reasons unrelated to the job itself. We have virtually zero turnover, he said. The company has also found that people who come to work recharge tend to be more productive, because when you go on vacation, you come back recharged. You don't wake up in the morning, you ask yourself, am I still going to this place today? That demotivation is enough to hinder your productivity. Am I still going to stand this supervisor? Am I still going to stand this boss? Am I still going to stand people talking me down, shouting me down? Those things you think about have a long way in affecting your productivity. It means you get unproductive before you even get to your workplace. You get demotivated before you get to your workplace, okay? And at the end of the day, you have nothing to actually write about. What you just do, you have what you call presenteeism. You are present, but you are not really productive. It's one thing to say you have 3 weeks vacation, like most companies do, he said. It's another thing to say you have cash. And if you don't go on vacation and spend this money, the money literally goes to waste. It's another level of saying this is real. That means you have cash that's available for you. Nobody's saying just go on vacation. We're saying go on vacation, we'll pay for it. If you don't go on vacation, the money remains in the company's coffers. So people are forced to go on vacation. How do you, let me just leave a message on the chat box. How will you feel when you go on a vacation that was footed, whose bill was footed by your company? When you are in that vacation, enjoying your life, having your selfies and doing sightseeing and feeling so good with yourself, what will run through your mind about your organization? To quit or to remain and add to its growth? Please drop your comment on the comment box. We have what we call the Premium Friday. I mentioned this in our other session. This was conceptualized in Japan, and by Japan government and the Ministry of Works, Ministry of Labor and Employment of Japan. It was conceptualized, I think about 2017, or so. The Japan government found out that workers were working so much, because if you look at Japan, that's where you have the highest number of man-hours that is clocked in every year. And they were dying, that's why I mentioned in the mental health class what you call karoshi, a Japanese word for death from overwork. People were dying from overwork. And they found out that this was too much. They were looking for what are the strategies that we can use. And research says that karoshi figure rose to 1,456 death in 2016 alone. Workers died from overwork. About 1,456 deaths were recorded in 2016. So they had to implement Karoshi in 2017 and designed to make people leave the office at 3 p.m. last Friday of each month. What that means, every last Friday of this month, people have to leave the workplace. Workplace that have adopted the workers are meant to close at 3 o'clock. And the study says the first year it was implemented, it said that's the first month it was implemented, certain airlines, resort companies, and vacation sites, they also lower their rate with over 26% so that workers can fly to different destinations, go to different resorts, just go and have good time. So workers can have time to go back home, stay with their families, and do what you want to do, travel to destination. But every worker look forward to last Friday of the month where they can have their own premium Friday. So it's very important when you live on that Friday, you are not coming back to work till about Sunday evening, and you resume work again on Monday. So it's what people look forward to in every month now in Japan. It's a way of giving back to employees to have their leisure and bond more with families. In the company where we run, when I was in Abuja when I saw this Premium Friday when it was adopted by Japan government, and I quickly called my office. I said, this concept, I see it as very noble. We need to embrace it. So that same year, we also implemented our Premium Friday concept. This is my colleague, and we even did a shirt to also showcase it. So there are three of us that took program. So we also implemented the Premium Friday concept. Like tomorrow now, which of course I think is the last Friday. Am I right? No, the other week I'm sure. So tomorrow is the last Friday. So all the workers here, they're going to leave at 3 o'clock. But I may not be able to leave tomorrow because I have a class to facilitate for 5 p.m. So I may be here till that time. But no worker is under any obligation to remain in the office after 3. Anybody that's seen in the office outside that, I send the person out on my own. So we've also adopted it. So these are some of the kind of smart concept you can also take to your company and see how it can work for you. So what we summarize as we close, the need to use smart approaches in bringing healthy behavioral change by management is very important. Leaders can create the needed health workplace ecosystem by leading the change. Any change that we want to lead, that leaders cannot lead, is not a change. The need to understand the changing dynamics in workplace management from authoritarian approach to more democratic and collaborative partnership is the new world order. So we have to start talking to our employers, start reviewing the management systems to shift them away, take them away from the usual military or dictatorial system where we can have partnership, where people can flourish and thrive while their health also thrive and their productivity is also achieved. Understanding of workplace psychological hazards and initiating timely smart mitigation is very good, because once you notice those things, you can nip them by the bud before they become epidemic within the system. As leaders, we must encourage wellness innovations, document supporting policies, and the right support towards implementation. Like I always say, what is not documented does not exist. When we have the concept implemented, let's also, after about a year or two, let's review it. Let's see how it has impacted positively on workers. What are the hindrances? And let's also see how we can also review it so that it can work for us better. The need to see and treat employees as our most valued assets and cater for their health and well-being is very important. That's why we talked about the factors of production in our last work, and we said man and capital. So it is very important. Let's speak more of purpose than we speak more of profit. Most times we talk about profit. Every discussion we talk about, we're looking at value chain, looking at profit. But let's speak more of purpose. I mean, above profit. Workers' well-being and safety are above profit. They need to learn. They need to lead from the front and work our talk. We need leadership commitment. Lead from the front, and let's work our talk. Not to say, oh, we must do this, but you are not doing it. Let's have that at the back of our mind. To the leaders also, remember also that we are not supermen. Most of us, we are at the airport, we are going to catch our flight, we are still characterized with work. I think this is one of the ways we must learn to cut down. the truth is that for me, I like to leave every work. I like to look around at the airport, seeing people, seeing new dresses, seeing people you have not seen before, seeing people walking and go. It's a huge excitement for me when I'm transiting in every airport. I don't stay in one place. I walk around. I want to see, have a feel of that trip. So most times we are even as executive, you're flying business class, and once you get to the business class lounge at the airport you are transiting, we are too serious. We wear suits all the time. I used to wear suits a lot too, but I think we have to also slow down those things. Let's relax our work environment. So when you have that business class ticket, you are in a business class lounge, you are not even able to utilize it because people who understand what it means to work relaxed, well-being, mental health, they are using it productively, but you are busy looking at who has sent you email, look at how to craft an email and send it. No, you don't need that. Let's slow down on this, okay? So many people spend their health gaining wealth. They have to spend their wealth to regain their health. This is what AJ Materi talked about. If we have succeeded, we have done a great job. Remember that your health allowed it. Every good job that you have done, your health allowed it. Learn to invest back to that health that allowed you to do that job, okay? Health is like money. We never have a true idea of its value until we lose it. So let's treat our health very invaluable, and let's see it as what we need to spend, knowing that we value it. Until you lose your health, you won't know what it means. I just imagine when you're sick, you're going through such a gruesome pain, you will know what it means to have health. Okay, now I have time. I was looking for money, sacrifice my time, sacrifice my health and well-being. All I needed was to be successful, was to have money. You have the money, now you don't have your health, you don't have your time. You are back to where you started from. Okay? First, I had the time but no money. Then I had money but no time. Finally, I have the money but no head to make use of my wealth. You need to work in a way that at the end of the day, when you are paid off, you can still have enough health to make use of your wealth. When you retire, there is no health to make use of your wealth. You have not done your life yourself any good. It's very important. The right behavior, we start putting them up as we learn of this today. Let's think while we walk home. What do I want out of my work life? What have I done with myself? With the attitude, the lifestyle I have been involved in, what is the prediction of my retirement age? Am I going to retire into good health? I'm going to retire into a life that there is no health left. What do I have to still recover from? What do I have to mitigate what I have done? Do I still have a room for recovery? There is. You better start doing it now. Your health is very important. Think about it. If there are things you can still do, I beseech you, in the name of God, take action today. It may have looked so dark, but we can take action no matter how little it is. Any little action you can take today, please take it. It will bring about good and productive outcome at the end of the day. Thank you very much for listening, and God bless you. I'll wait for questions now. Questions, if there are any.
Hello.
Hello.
How are you, doctor?
How are you?
Thank you very much for this informative lecture. It's really good. It's a good training for us. And there is many points we need to do it in our life.
Yep.
I do have something. Usually, as you said, we should be ourselves. But sometimes the culture of the community around you will force you to do many things. So how we can overcome these things?
I want to come again.
What exactly?
Can you come again? Ask that question again.
Okay. I'm telling you, like, if I want to make something new in my hospital for the staff, like a willing program,
Yeah.
or such a thing, then you need to modify their lifestyle, increase they're willing to do exercise training, or at least like asking them to go to work, walking, or use this time of like an exercise, something like this, to introduce exercise in their daily life. The problem is the culture in the community is not allowing that. In the community we live in, it's really difficult. So how we can overcome this?
Okay, if I get you right, there's a cultural interference to what you want to do and how you want to. I may not know what happens in that community. What you can do, for me, I like what you call improvisation. I always like to improvise whatever I find myself. I get bottled up in a lot of programs I find myself, but I always look for a way to find. I always find a way out to make the best out of what I have with me. What you can do is, you never can tell when you have that program and you communicate it to everyone. The truth is, once a program is communicated, it may not be everyone that will buy into that program. You may have about 50 workers, but if it is only 2 workers that were able to buy into it, it doesn't mean that they must do it in the workplace. Let them understand, but I sell my program with what you stand to lose and what you stand to gain. Once you have that gain and benefits, that consequence and benefit clearly discussed, people are willing to make adjustments. Let them understand, how long do you want to live like this? What's your weight now? And if he tells you his weight, can we check use your weight and your height to calculate your body mass index? And you look at the category that you fall into. Let the person know where you fall into. These are the risks you are exposed to. But the truth is, don't you want to stay healthy? So what you are doing personal persuasion. But at the end of the day, people who listen to you, that they feel that their health and their well-being matters to them, you do something about it. But like I always say, whatsoever is important for you, you create time for it. But you may not be able to get the buy-in of everyone based on cultural influences or cultural biases. But the ones you're able to have to buy into your program, even if there are 2 or 3 out of 50 staff, celebrate yourself. That's a good success. Okay?
Yes, thank you very much.
You're welcome. Questions? Let me look at the chart. It looks like there are some questions in the chart here. Somebody's asking a question. That's a fan though. It's talking about vacation. If I think this will work in a hospital setup, it doesn't matter where you work. By WHO regulation, by an ILO, you are supposed to work and be entitled to vacation every year. Every year you are required to go on vacation. So except you don't want to use it. So it depends on where you work and how you want to take your vacation. You see, the truth is that having the kind of support that you saw in that company, it depends on what the leadership understands about people's motivation. That will determine what can happen. But vacation, yes, everybody's entitled to vacation, irrespective of where you work. Okay. Okay, I just got a message from Joseph. He said, how do we create a workers' health and well-being program in an organization which has a bad safety culture? I totally agree with you. Everything you have to do must start from the culture. That's why I talked about leadership, policy, and culture. Because if the culture is not there, it will get choked out in no time. The culture is what gives it the oxygen it needs to survive. Once you don't have the right culture, it will be difficult. But that's why we're not looking for leaders today who can come and declare profit. We're looking for leaders who will come and help use the employees to improve their well-being and achieve results, who sets partnership between profit and well-being of employees. So if the culture is not there, definitely you struggle with it. Okay. Oh, sorry, Fando, you said there was no sound on my side. I'm sure that was recovered over time. Okay, Monica is saying here that he's just registered with a nutrition coach. That's very good. So you decide what you want to do is very important. Okay, that's okay, Bea. So this thing. Okay, somebody, Linda, that's very, Ayanda Adepisi, that's very good of you. He said, I have stopped taking soft and caffeinated drink since it takes very good. I think we mentioned it last week that it takes you about a week to pop out those caffeinated caffeine that you take, those beverage drink. It takes about a week or so for that thing to leave your system. She has stopped. I mean, we must applaud this. Every little success you record, we must applaud that. That's a very good one. That's a very good one. Congratulations to you at ABC. I met a lady in one company that worked for a cement company. We're doing their annual health assessment. You know, went to do health assessment. In the report, when we did her sugar level, it was so high. It was so high, and it was scary. And we had to talk to her with the outcome of the report. But what she told me was that she's addicted to Coca-Cola. That she can never eat a meal without taking a bottle of Coke. That means averagely it takes about 3 bottles of Coke in a day. So we had to take time to, talk to her to a point that she became a point of vulnerability. We spoke to her to a point of vulnerability. What we did was to lead her to her. She led us to her office, and we got to her office. She showed us the pack of Coke that we opened our refrigerator in her office. It was all black. It wasn't that it was painted black. The black was the color of Coke, and we had to talk to her. But I'm happy today she's been able to get out of that, and her diabetic condition has greatly improved. So this is a very good one you have done. Well done. Okay. I'm looking for more questions. Okay, good one. Somebody asked Kofi. Kofi says he now walks home after close of work. That's very good. So that what you can do, Kofi, is to download the pedometer into your phone. So it's able to tell you averagely how many steps you take per day when you're walking home. So that's also very good. This is also a very good initiative. I told you last week, most of those things you can set those smart things you can do. It's very important. Okay. Okay. Any question here? Let me look for that guy. Any questions? Any question? Okay. Somebody wrote something. Thank you, Muna. How do you convince leaders to buy into workplace wellness program? Very good question. One of the things you can do for leaders to buy into is that's why I tell professionals, don't start from drawing a big list. This is what I want to do. Start by letting them know how much they stand to gain, how much expenses they stand to cut, how much improvement this will bring in. Just what you need to do, just look at how many people have gone to clinic for the past 1 year, because you can relate to your doctor, find out among these, how many of them actually going there for maybe illnesses that are avoidable. And start from there, draw a program, simple program, and don't bring program that way, because most employers, once you bring cost to them, they are not interested. Don't come with cost. Sir, I just need your approval. I think maybe on last Friday of the month, maybe we can do 30 minutes aerobics. I'm an aerobic instructor. I can do that if you can allow, so that instead of closing at 5 o'clock, we can all close at 4:30. 4:30 to 5 can do the aerobics one Friday in a month. And once he buys into that, a good way to start. So once he buys into that, seeing how people are beginning to embrace that, then from there you introduce other things. Then begin to drop further programs that can complement what is currently existing. So approach it from the part of benefit, not from the point of cost. So that's a better way to approach it. Okay. Very good. Somebody is telling me here now, Helena said she doesn't take sugar anymore in tea. Very good. Me, about some months ago, I also called that I take coffee. I mean, most time in the office, but I don't take coffee with sugar anymore. So I've called down on that. So look for what you can do. Simple things. Like I told you that my waste bin is outside my door. So when I want to trash anything, I must walk out of the seat, go outside my door and trash before I come back. So smart things that you know can help you. I work on construction sites, so walking is the norm. I totally agree. Those that work in construction site, they have enough. They don't really have a high sedentary issue, but except those who work in the offices where we become couch potatoes by sitting so much on couch, you know. And I realized I saw a study recently that said the more we get promoted into a management level, the more sedentary we become. So that means when we're working as junior staff, we had more opportunity to physical activities than we have when we get promoted into management level. So at that time, we found out that we have people that report to us. We just sit on our seat and roll out our seat like this and call people through intercoms. So understand the fact that that is a behavior. So you don't want to craft a career for you that God has helped you right now, that you have not become a manager. All you want to do is to sit and just become look like you are sentenced to an armchair. You have an armchair sentence. You know, no, that's not good for you. Okay. First, I should please throw more light on pedometer and daily steps. Okay. Let me just, I want to show you my step for today. It will shock you that I haven't even done so much. Pedometer is a device that some come in form of wristwatches you can wear throughout the day. So as you step, it rates it. Okay, if everybody see me, because I have been seated all through, look at my step, 672. That's all I've done for today. I'm sure you're all saying this, right? So I've only done 676 steps today. This is already 2:30, and I've only done a 7 minutes walk. 7 minutes walk. I've only walked for 7 minutes. So what pedometer does for you is it helps you to monitor. Like now with this app right now, it tells me that there's no truth about it. When I get home today, I must do an hour walk at least to cross the 5,000 benchmark. Weekends, I do more than 10,000, but work days, I cross over 5,000. So definitely, necessity is laid on me that when I get home today, I'm definitely going to walk for at least an hour to be able to actually cross the 5,000 threshold I've set for myself. You can decide what you want to set for yourself: 5,000, 10,000, 7,000, whatsoever you know is reasonable. So set it for yourself and see how you can achieve it as you go along. And this pedometer, because the more you walk, the more physical activity you get involved in, the more your fat burn out. Okay, so pedometer helps you to know how many steps you have taken. He said yes. I was looking for. So the pedometer helps you know how many steps you are taking in a day. So now, if I didn't have a pedometer, I won't know how sedentary I have lived today. But you can see, from morning till day till this hour, I have lived a high level of sedentary life. So I still have enough time to burn it out. That is the decision I have to make, and that I will do today when I get home in the evening. So if you didn't have this, you wouldn't know. So it helps to monitor how many steps you have taken per day. So set a benchmark for yourself. You want to do 5,000, 2,000, it depends, but I think 5,000 is the least that you can go. If you find out that at 4 o'clock, like sometimes I'm here, I find out that at break time, at my lunch time at about 1 o'clock, I have not done enough. After lunch, I talk to my colleague. We just walk around the estate where my office is. So I'm able to do, quite a number of steps, and I come back to sit. So whatever is left and I'm owing When I get home, I do that. I may not even go out. I may just do that just walking around in the sitting room until I clock those steps. And when you clock those steps, it depends on the soft application you downloaded. My own, they applaud me and they give me an award. And those things are very, very motivating. Okay. Try and in your phone, look at your phone, look for pedometer or step counter, download it. Somebody say, yes, once management understand the cost of working with unhealthy employees, compensation, loss of company compensation, then they will absolutely correct. Because when you deploy these plans, it helps you reduce all those costs, compensation, litigation, and all have you. Okay. So I need questions. Let's talk. Okay, while we're waiting for more questions, I want to ask again. Each person, please, can you write down on the chat box, what are those 3 priority things you want to deal with by virtue of what you've learned during this program? I feel I have to deal with this, I have to deal with this, I have to deal with this. I will commit myself to this and ensure I do my best. Yes, Monica, your hand is up. Kindly unmute yourself.
Hello?
Yes, we can
Hello?
hear you.
Okay, good afternoon, everyone.
Good afternoon.
Again, thank you, AE, for this wonderful opportunity to participate. So much to learn, information overload. I hope that's not a risk.
I don't know yet, but I'll find out.
Okay, so I wanted to say, actually, I've typed in what I wanted to say, but I just felt I should say it still.
Yeah.
If you look at most of the risk assessment reports that is done by us occupational health and safety practitioners, professionals, you discover that focus is always on safety risk, and hardly will you see health risk assessment in that report. And that's also where most of the controls are also focused. And you don't blame the management so much because, of course, it's based on your reports that the controls are implemented. And so I just think that there's a need for us to, even me as a consultant, I'm really beginning to rethink really. There's a need for us to really focus much more on health risk assessment, because health related hazards are not something that we see readily. So most of the time we tend to pick on those ones that are readily staring us in the face and readily obvious to us, whereas these hidden ones are actually having much more impact on the overall productivity outcome of the organization at the end of the day. So I think the need for more emphasis on the fact that there is safety aspect of it, there's occupational health aspect of it, and of course, that of occupational health aspect of it is not as loud, if you understand what I'm trying to say.
I do understand.
Really not as clearly pronounced like we would lay emphasis on safety related initiatives. So that's just what I wanted to emphasize, that there's need for us to remove our focus, not really remove our focus from safety risk, but focus a little bit more on the health risk aspect of it, health hazard, and then let it become a major part of our risk assessment document so that adequate controls will be put in place. Right. Thank you once more for this lecture.
Thank you so much, Monica. I really appreciate that contribution, which of course that came very handy. The truth is, like, if you remember last week, I mentioned that accidents only constitutes about less than 20% of the issues that we have in the workplace, but health risk, that lead to occupational illnesses and all have you, contribute over 80%. But traditional safety experts have realized, and that's one thing we'll be trying to change. Traditional health and safety experts, they focus more on safety. My company, the company occupational and safety managers, we are 70% occupational health company and 30% occupational safety company. So that's why when I do risk assessment, you hear loud and clear heads shouting from what I do. And that's why we must start seeing how we can harmonize the whole system. When a thorough safety professional does assessment, risk assessment, all you will see is risk, accident, and related issues. When occupational health consultant does a risk assessment, you will see those things. But there's need for us to bring all the knowledge together, because you can't talk about accident without talking about the health assessment or health safety within the workplace. So it is all it all has a place where they meet. So thank you, Monica. It's true. We really have to sing that loud, because what you end up as your report, what you come up with as your report is what management approves funds to be implemented. And once you miss out health risk assessment in your report, you can't blame management. Is the occupational health manager in that company that's not giving attention to health. Thank you so much. I'm looking for more questions.
You know, the best way on paper opposed to events was with my first thoughts to the far post. Drought, Salo sending the first really 29.
Anthony Omona, can you mute your mic?
And then in the second half,
Anthony Omona, please mute your mic.
Silver's headed went back across the goals.
Let me look for that person and mute him. Okay, I'm seeing some questions here. Somebody is asking how to use a pedometer. Two ways. I said there are two. If you have the one that comes in form of wristwatch, that one is always in your. I mean, when you leave your house for work, is with you. It's on your wrist, and wherever you walk to is reading whatever steps you are taking. But what you do when you have the one that's on phone, deliberately learn to go along with your phone. When you hold your phone, wherever you go to, any step you take, it reads it. Like when I'm walking this evening, my phone is right on my phone pouch, and I'm walking. So wherever step I take, it reads it. Okay. So DBC said recent phones come with built speedometer as a health application. That's true, and so it makes life easier for you. Fando is saying wellness program could be linked to occupational health clinic so that it be effective. Yes, but the truth is that it's not every organization that have occupational health clinic. You don't wait for occupational health clinic before you. What if you don't have a doctor in your workplace? So does that mean that you can't have a health? You should be able to actually create a health program, awareness program. It is when you have further issue you want to investigate that you can now advance to your occupational health clinic who can help you evaluate. But if there is a clinic, you must work hand in hand with the clinic to actually create a wellness program. Yes, Mamuye, you have a question, right? I'm seeing your hand up. Let's hear from you.
Oh, yes. Good afternoon, everyone.
Good afternoon.
You were referring to the issue of health risks being given or having higher percentage than the safety risks. I want to think that maybe it was due to a change that has happened. I don't know the history of occupational health and safety, but in the old days, when talking about occupational health and safety, we are talking about occupational health and safety. But nowadays, most organizations are talking about occupational safety and health. I think this thing led to all the organizations to lead to give the health aspect the lesser look, while they focus more on the safety risks, because the safety risks are sudden and they are easily seen, being easily notified at the workplace. Therefore, most of the time, if they are catastrophic, we know that the compensations will be there, 1, 2, 3, 1, 2, 3. But with health risks, most of them are taking long time before they can be evident. So we are not cognizant of them. We are just letting go. You are old. You had to have a musculoskeletal illness, not considering that we are doing nothing. We are overwhelming our employees. And I was very impressed about you saying that when most of us are having sick building syndrome, hey, this thing is killing people. Every now and then when they get to workplace, they report to be sick. Thank you.
Thank you so much. Thanks for your contribution. Let me just really add to what she said. I think that's very correct, because like in our the discussion last week, we talked about even the ILO didn't recognize most of these things as occupational health illnesses. I mean, all we're focusing on was safety, safety, and safety. And talk about the nomenclature, the acronym that she just brought up. When you hear ILO talk about this issue, they will talk about occupational safety and health. When you hear WHO talk about this issue, they will talk about occupational health and safety. So WHO was promoting more of occupational health issues. ILO was promoting more occupational safety issue. But from recent studies, even the ILO have realized that they have promoted safety so long above health of workers that even accidents are beginning to reduce to a great extent, but those health-related issues are becoming to be a big problem. That's why you see ILO spending a lot of fun talking about sedentary lifestyle and all have become critical issue being discussed in the workplace. So that's how it is. But I think as at now, the focus is shifting. Instead of using the word occupational safety and health, you're not looking at occupational health and safety, because those health issues are beginning to spiral, and we're beginning to see the effects of not just the employees, but the employer's bottom line. And even right now, we're having what you call retirements on health grounds. I'm sure you'll be seeing that people are being retired because they are not that they are within the age of retirement. You find out that they have health issues that make them disabled. They are forced to be retired on health grounds, and those are key issues we should start looking at and looking at ways to address. Disability at work is a key issue. These are issues that are coming up, and it's going to be worse as we transit into the future of work. I mean, look at right now. We're already having tomorrow I'm dealing with a certain company. I'm speaking to them on the issue of ergonomics management in relationship to remote working. People are working at home and people are sitting on sofas with their laptop. I mean, pain is a key. It is a new world order, and there are many approaches that are used to manage this. I mean, in terms of awkward body posture and all have you. So there was no time to plan for this. So we are all stuck on the same boat, trying to manage the issue at the same time, watching the information change and evolve over time in the same time. And it's a big issue, but we have to just look for how we can create decent communication, healthy communication, and keep reinforcing this discussion in our workplaces to ensure that, yes, we have a pandemic, but in the midst of the pandemic, how do we put information across that people can use to ensure that they still live a healthy and decent life? Because one day this pandemic is going to end. What we all should start thinking about right now, when the pandemic ends, how are we going to turn out? We are going to have what you call high level of disability in the workplace based on people who have been cushioned to one part or in their house. They have to sit and squeeze to work and what have you. Illnesses that are not, you may not have accidents right now, but you are going to have what you call a whole of new illnesses that we do not know are going to come up that are occupational health related. If you have time, Google what you call Homo computeros, HOMO, then computeros. I mean, a certain woman in University of Tallinn in Estonia did that report that, I mean, talking about the evolution of man. Man started by crawling and picking things on the floor. Over time, it advanced his world to start doing bow and arrow, and now he's back to that place where he's confined to sit and teeth for the rest of the day. And if this is what man is going to go through in his entire lifetime, and that image she used to represent Homo computeros, it's not a nice one for us to behold. So these are changes that are happening, and we have to see how we can walk around, I mean, navigating around them. But at the end of the day, that's why I said, take this issue personal. Don't wait for your boss. Your boss is fighting his own risk. Take it personal. You yourself and those that you can advocate to, but ensure that you do the right thing so that at the end of the day, it should be too sad having worked for how many years you are paid off, and the money you are paid, you are now using that money to look for health. It doesn't make any sense. Okay. Lasesa, do you still have a question? Your hand is still up.
I'm sorry. I forgot to drop it down.
No, it happens to all of us. That's fine. Any question from I'm looking for questions. Okay, somebody's. I mean, I can see the commitment everyone is making. I need you to this commitment you have made. Write it down. When you don't write something down, it's difficult to remember. It's called fluffing the mental pillow. Your mind is processing many things at the same time. What you don't write down. I feel I'm getting old. So everywhere around me, I have books. I write down things everywhere. So that I don't forget things I need to remember. What is important to you, write it down, because most time it crosses your mind. If you don't write it down, you forget. So whatever commitment you have made, write it down. If possible, put an alert on your phone. Like even while as you sit in the office, there's what you call the 20-20-20 rule. I'm sure we're all used to that. What this means in terms of sedentary behavior is program yourself. When you walk for 20 minutes, have 20 seconds to stand up, sit up, and stretch, and have 20 seconds to focus on 20 feet ahead of you. What you're doing with this is that it relaxes the muscle that have gone tensed in your eyes, because understand the fact that these are electrons we are gazing at every time. So it helps to relax the tense muscles that come from your eyes. So understand that these are things, smart things we can do while we find ourselves in such a time when we have to be glued to electronics. And the more we have technological advancement, the more risky workplace becomes. We are talking about the risks today, and I understand that the fact that we are going to have our robot counterparts. They are going to come in very soon, where robots have to work, have to force to work at its own speed, and you must have that at the back of your mind. What you want to do, how the workplace is going to change. Talk of robotic apocalypse and outsourcing that will come heavily in the workplace, extension of extended work hours, and what have you. It's going to be a lot of issues. I mean, I read some time ago in the report, because I'm also monitoring what is happening in the robotic technological age. I met a lady in Austria. She was working on such report with the European Union Commission, and she engaged me, and I almost spoke to her. I was scared of work. I mean, trying to come back to my country. But all that she told me, I got afraid to even resume work. So, but you have to prepare yourself to know what is going to happen. As at now, I think that there's a hotel that has been tested in Japan that was built, and the hotel said they want to employ robots to run the hotels, and that's why we start having what you call the fallibility. If you read the fallibility of robots right now, and the gaps that we have in the robotic technology. So they employ robots to run the hotel, and it was not up to 1 year. They fired over 50 robots. I can't remember. They fired over 50 robots. Why? Because the robots couldn't just meet up with the kind of work that a man would do. People calling to book rooms, and they come in the day they take the booking. They come in the day they want to book. They found out that they were not documented by robots. So a whole lot of issues are coming in. People complain that their water is not hot, and robot takes the call, and the robot does nothing about it. So there's still a lot of gap. So I still see when I hear that, when I read a lot of reports that say a robot is going to compete with job. No, I don't think. I think when we finally enter the robotic era, it will create new jobs that we need new skills for us to scale up. But I tell you the truth, no matter level of technical advancement, man will still find himself relevant within the workplace. The robot doesn't have emotions. Robot can manage human beings. The robot can act as human resources. They can calculate a lot of stuff, and the accuracy. Robots. I was read that robot was created to take care of the error in man, because when we calculate figures, we may have errors. But robot calculate figures. I mean, that. Use Excel, it gives you the right figure. So these are the things. But there are roles that robot will play. The robot will play. There are roles that man will play in the workplace. So there are really no issues for us to be worried about. Okay. So I beg you, how can health and safety regulations monitor health hazards, enforce hazard allowance in workplace? First thing, most health and safety policies don't even understand what is called health hazard allowance. That's one thing for us to look for. You know, like, you see, the truth is that legislation across African countries are still very poor when it comes to health and safety governance, and that's the truth. I was reading through a document the last time. I still found out that in most African mental health policies, I saw that I realized that we are still using the colonial policies where you have what you call the lunacy ordinance. I mean, we don't use those kind of words in mental health anymore. That's what we see have still run in national mental health policy. I was having a discussion with a lawyer within the week on a live Zoom program, and one of the things I took from that discussion is that the laws that we have to even prosecute issues that concern workplaces still refer to mental health as insanity. So the more we have those legislations that have not been repealed, that still refer to mental health condition as insanity in our laws, you find out that when somebody says that, yes, I have worked and I felt that I had mental health disorder by virtue of the work I was subjected to, how I was treated, that it means the law that we have that's talking about insanity cannot adequately deal with those issues. I mean, the lunacy ordinance was first set up for Nigeria, was first implemented in 1916 and was repealed 1968. And we are still taking our law, crafting it from there and still using it now. It doesn't make any sense. We need to start advocating in our respective countries, reviewing our OSH legislations, no matter how it is. Most countries' mental health law does not understand what occupational mental health means. It means the mental health legislation in that country does not cover workplace mental health. As a matter of fact, even the Nigerian document does not cover workplace mental health. I was having a meeting in Geneva. I met the guy who was part of the people that did the mental health policy of Nigeria. So I was presenting a paper and the gaps, and I mentioned that most times there are no wider consultation for us to arrive at those policies. When I finished, he came to me and said, what you said, when you mentioned that, I felt guilty. I said, what happened? He said, because when we were writing the Nigerian mental health legislation, it was just about five of us who were psychiatrists that wrote it. We never consulted anyone because they left out Ministry of Health, Ministry of Labor and Employment, because they are the ones that will tell you the magnitude of the problem in the workplace. So what you have created is a mental health policy, but it doesn't take into cognizance the mental health burden that happens in the workplace, which of course are labor related. So these are some of the issues we start discussing in our countries while we go back, talking to our government and seeing what we can do. I'm sure those who are in OSH Africa platform saw what I posted sometime within the week. And many of us are having visions, are part of our Vision Zero advocate. There is currently what you call Vision Zero Fund. And that Vision Zero Fund is accessible to all countries. But I realize we could be so relaxed. There's a high level of inertia in Africa that what is due us, we don't ask for them. It's accessible to all countries. And when I was in that ILO meeting 2 days ago, I realized only 2 countries in Africa have accessed this Vision Zero Fund. And those countries are Madagascar and Ethiopia. We have 54 countries. And ILO will not talk to you as an individual. They want to talk to their social partners. The social partner to ILO in your country is your Ministry of Labor and Employment or the NSITF. You should talk to them. Make this known to them. And if I have it, I will email you, I will email everyone how the Vision Zero funds can be accessed. There's a document to that. I'll send to you as an email after the program. Hold your Ministry of Labor accountable. Let them go access that fund. It will be used to implement health, safety, and well-being, because that's what Vision Zero stands for within the workplace. Let's not be. I felt so embarrassed knowing that 54 countries in Africa, only 2 countries. I mean, we're talking about it, and the Minister of Labor and Employment in Ethiopia was speaking, and the guy from Madagascar spoke. What about these are 2 countries you don't even hear about when it comes to health and safety. What about the other countries? Where are the ministers of Labor and Employment? If you don't say this is where I am, nobody will tell you that's where you are. So we need to start knocking on the doors and see how we can access these funds as well. Any other question? If Lasesa, your hand is still up. Do you still want to ask a question?
No.
I think we need to report you to Zoom actually, as a matter of fact. Anyway, that's on a lighter note. So if there are no more questions, maybe what we may do is possibly to call it a day for today. And I must thank you so much for those who have been in the class for the past 2 weeks. I need you to write us. I need you to write to us, okay, how you feel about this course. When you are submitting your final assessment, just write how you feel about this course, how beneficial it was to you, and what you want us to change, and the value you place on this course. Because we need those testimonials also to also know what we're doing and evaluate what we're doing. Okay. So if there are no further questions, in the next.
Hello.
Yes.
Sorry, Ndate. Is there another assessment that has been posted, or was it the one that we posted last week?
No, I'm going to say to you, in less than 2 minutes after this meeting, you have an assessment sheet on your mail.
Okay.
Yes. So I will need you to quickly attend to that and send it back to us, and so we can evaluate. But the truth is, let me say that here. I realize, I think one of the things we should discuss here is issue of stereotyping. Okay. Most of us are so stereotyped that what we have heard as our belief before the class teaching was not able to change it. I'll give you an example. Somebody who answered eating phobia in his pre-assessment, still holding on to eating phobia in the post-assessment. But I would have thought that the essence of the class was to alter those your head belief. But we realized that a lot of people were still very stereotyped, and they didn't change that belief. And people that scored 14/20, I saw them still scoring 14/20 after the class. A few of them, people that scored 16/20, I saw them not scoring 14/20 after the class. And I'm beginning to wonder, the assessment, the first assessment, was it a guesswork, and the post assessment was your real value? So I will figure out a way to unravel that mystery, maybe in subsequent classes. But I don't feel I should bring that to you. So when you come to class, listen carefully and let what you have learned, let it inform your opinion in your post-class assessment, because we want to see that's what we use to measure your level of impact that the class has had on you. Okay. Okay. On that note, ladies and gentlemen, I want to thank you once more for being...
Hello.
Yes, madam.
Yeah, please. How soon are we going to get the presentation?
You're going to get the recording of the 2 classes. So
okay.
once the link is ready, I will email it to everyone for the 2 weeks.
All right.
Thank you so much.
Thank you.
All right. So I once again thank everyone for having that confidence that we could influence your behavior and you could be in our class. It takes a lot of courage to trust people to be able to be to be of value to you, and that we have seen. So we thank you so much for the time. I can say everybody has still been here for the past 2 hours. It's exactly 2 hours right now. Thank you for the time and for the trust and confidence you repose in our competencies. We'll keep looking at what we feel are the new topics that we can bring your way that can improve our behavior and our overall performance in our workplaces. So until then, I want to say have a good evening and enjoy the rest of the day. Thank you so much.
Thank you, Ehi.
Thank you so much.
Thank you.
Thank you.
All right, thank you so much.